Nation is measured by how healthy her people are. But how can this wealth be achieved when one out-of-the-pocket expenditure is still higher than 40% of the total health expenditure in majority of African countries where millions depend on a daily wage for survival? In 2017, the county government of Kisumu set up an ambitious plan of making healthcare affordable and accessible for all its citizens by establishment of a universal health insurance scheme.
We are starting our own universal health coverage in Kisumu County, beginning with those who are not able to pay for NHIF. So, Marwa Solidarity Health Fund is aimed at covering 90,000 households in Kisumu County. And we have done a thorough research and we have found these households.
In 2019, the Kisumu County Health Act, stipulating mandatory health insurance for all Kisumu residents, was lodged and passed at the Assembly, giving the green light to the establishment of the scheme. However, questions still arose on how the less fortunate would comply and pay for insurance premiums. Was it going to be truly accessible to all? On 21st September 2020, Kisumu County partners with Farm Access for funding of a county social health insurance cover for all its residents. Kisumu County then signed a memorandum of understanding with the NHIF of a payment of premiums to selected beneficiaries. On 16th of October 2020, Marwa Kisumu Solidarity Health Cover was unveiled. Beyond the historic shaping of Marwa, and Kisumu County becoming the first in Kenya to navigate the waters of insurance-based UHC model, Marwa bestows a peace of mind for Kisumu residents and hope of economic stability for all.
Ne achandora kabisa kanya radio operation Nakuru. Ne school to gochna ni utuo. Kuro tuo to kadhi kuno to ne Nairobi mokwongo. Askando ka oro men yodhi kuno ne wanka kata gimora mora dala. To operation wach ni operation daktari pimo wach ni operation. Operation ndio ni mondo michake gi siling 70,000 man watero ka gimora mora pok watimo. Koro the operation for only 2 days. So miswa kawuono 2 days of the operation. Ne wabedo gi shida kabisa ko gochno ka wandala. Account na nangi only 30,000. Idoro 70. Ne angi NHIF to ne na dongi go we ne poka chudo for 2 months. I mean for 2 weeks. For 2 months. Koro kana dhi kuno to misa ni ogenyal cover nyaka tieko gowi. Kaseti gowi cha ka keno 3 days ka koro gino beda ka account na bedo active. Koro ne awinjo ka naneno matek ahinya. Alafu nochuna madhi akawo jamni mane an godo. As nitie mchele mana keto stock kaka ngama jopur na keto mchele moko stock na biro tima na biro nyiewo seche ma school fees mag nyithindo go jopo. Nochuna ma jaka de nyiewo mchele go mari 110,000 on top of 70,000 monotimo logistics kigole Nairobi kitere.
We are going to reduce deaths, we are going to increase life expectancy, and we are going to improve the quality of life. Those are the expected impacts because it is going to include those who cannot remove money from their pocket when a disease comes, and it will not lead to what we call catastrophic expenditure.
Membership in the Marwa scheme affords one the NHIF super cover, giving access to in- and outpatient services, road ambulatory services, referrals, maternity services, dialysis, kidney transplant, surgical services, oncology, radiology, chemotherapy, MRI, and overseas treatment. At the onset, Marwa took care of the less fortunate. Going forward, plans are underway to ensure that all residents of Kisumu get covered.
The group that we are now going to is the people who might be having some little money, who are not indigent. They pay, they work, they pay, they sell they sell vegetables. They have some work that they are doing, but they are still not insured. And that is the group that now we are trying to capture. So we are trying to see a way in which we can bridge all these people so that Marwa covers all of us.
Marwa ni kitu nzuri kwa sababu mara mingi si watu bodaboda, mara mingi wanapata ajali, mara mingi unapata labda wakati unaendesha pikipiki, hiyo upepo mara mingi una affect kifua. Na mara mingi ni kitu inakuja na kushika wakati ujitarajia, kwani sio kitu inabisha hodi. Ile kitu unashika tu mara moja ushagonjeka kwenda hospitalini. Na ukishaenda hospitalini gharama ya maisha sasa ni maisha ngumu. Yenye huwezi kujimudu kama huwezi pata msaada kutoka mahali popote. Mimi upande wangu ningependa kuwahimiza watu wa bodaboda, hii kitu ya Marwa ni kitu mzuri. Inaweza tusaidia hapo mbeleni.
There are some vulnerable women. They cannot afford even 200 shillings per day. But they can come out with an initiative. Educator wa mama, watoe even if it is 100 ama 10 bob per day. So that they can, at the end of the day, they collect something and they pay for the NHIF.
Marwa not only takes care of the premiums payment for the residents of Kisumu, through its institution, the public health system in Kisumu is set to be lit.
Our idea when we started Marwa was to focus first on how we can bring our first public facilities up and improve quality so that they are able to compete with the private and public facilities. Open up Marwa so that we have healthcare service access across the board.
Hii Marwa tuweke nani iwe kitu ya maana, tunaona kama kitu yetu.
Nyong'o, Kisumu County.
So in belonging, let's secure and protect affordable, accessible, quality health.